The purpose of this video is to go through the joint mobilizations that I alluded to from the lecture video. So I have my model Cole, and I'm going to walk through the talocrural, the tibiofemoral, and the femoral acetabular joint mobilizations. We're going to start off first with our ankle mob. So the first one that I'm going to talk about is the anterior glide. So remember how I talked about the different terms within the lecture video? If I'm doing an anterior glide, that means that my ending position will be anterior. So technically I'm going from posterior to anterior. So I'm actually going to have Cole prone, so he's going to lay on his belly with his feet hanging off the table. So I flip over. Perfect, and I'm going to do this one. And so I'm going to have him in an open packed position. So I'm just going to slightly dorsiflex him with my thigh. So this would be maximum dorsiflexion. This is not what I want. I want him slightly past neutral. I'm going to stabilize his distal tibia and distal fibula. And then I'm just going to push downward, applying a little bit of distraction. So I'm pulling the talus slightly away from the talocrural joint, and then applying a posterior to anterior glide. So I'm starting posterior and I'm pushing anteriorly. Just like in CPR, remember we don't want to bend our elbows. It's the same thing for a joint mobilization because we don't want to have to be in this position really muscling it for several minutes. By just keeping your arms straight, you're able to just use your body weight and when you're applying that force. So when we are doing an anterior glide, so again, moving posterior to anterior, that's going to facilitate ankle plantar flexion. For a posterior glide, Cole is going to be supine. I'll show you two different body positions. So Cole's laying his back. Good. I'm going to have him bend this leg so it's out of the way. Again, I'm going to have him slightly dorsiflex, so I'm just using my hip to kind of hold him in that position. I'm going to stabilize his distal tibia and fibula, and then again I'm applying slight distraction, so again pulling the talus away from the talocrural joint, and then applying an anterior to a posterior force. So this would be one of the first positions. Another position that you can do this in is having the patient kneeling on the table. So can you get in like a half lunge with this knee forward on the table, facing me? Good. And so again, the patient is in the position that I want him to in terms of how dorsiflexed he is. I'm going to apply some force with my thumb pushing on the talus. So again, I'm applying anterior to posterior force. And then Cole is going to just slightly rock his knee forward, making sure his knee doesn't go past his toes, and then back. So that is also another way that you could do an anterior to posterior glide. And this would help increase ankle dorsiflexion. You can go ahead and lay on your back. Actually, you're going to go side like that, so lay on your side. Yep, perfect. So let's start with this one first. So you're going to scoot down towards the table. So now we're doing, good. We're going to do subtalar, medial, and lateral ankle mobilizations. So if I am doing a lateral glide, I'm starting medial and I'm pushing the calcaneus lateral. So I'm going to apply distraction to the calcaneus. I'm actually going to switch my hands. So I have the distal portion of his tibia and his fibula stabilized with my left hand, and then I'm applying distraction with my right, and then pushing from medial to lateral. When I'm doing this motion, I'm going to increase ankle inversion. If I wanted to do a medial glide, so again going from lateral to medial, I'm going to actually just have you switch your feet. Good. Keep this one to the side. I'm going to apply distraction on the, I'm actually going to have you scoot up a little bit tall. Good. I'm going to stabilize the distal tibia and fibula. Again, apply distraction on the calcaneus and move from lateral to medial. So that's a medial glide. And that's going to facilitate ankle eversion.